So they're two different conditions. Although you can get a lot of times, actually, not sometimes, you do get anxiety and depression together, and you do have a condition in ICD-10, well, ICD-11 now, but ICD-10 called mixed anxiety and depressive episode. Um, the association is such that a lot of times people who are anxious can go ahead to develop a depression. People who are depressed usually are anxious as well. And the connection between the two is, for example, let's assume you're anxious about something, whatever that thing might be, and it's a long-standing anxiety that doesn't get resolved in time. In time, it can be what you call a life event that can trigger a depressive episode. So depressive episodes are usually triggered by what we call life events, which could be the birth of a child, marriage, divorce, the death of a spouse or a close relative, big things. And these life events, as I've mentioned, are anxiety provoking situations. They make people worry. They cause people to think about the finances. Are things going to go well? If you're coming to the end of your marriage, how are you going to survive, depending on what the dynamics were in the relationship. So that it's quite a close relationship in between the two. You can have anxiety on its own and not be depressed, and you can be depressed and not be anxious. But a lot of times, because it's a life event preceding depression, with life events comes anxiety. And again, life events cause anxiety, which if they're around for a long time can cause somebody to become depressed. So they're quite closely linked. And that's kind of the relationship. So it's not uncommon for you to come across a lot of people who are depressed and anxious and vice versa. So it's difficult to say. I mean, it obviously it impacts on the person's quality of life. If you're somebody who's anxious all the time or have a specific anxiety that goes untreated, then you start to avoid whatever that cause of the anxiety is, and then it reinforces the cause. So that's how phobias develop, for example. And phobia, when you think about anxiety related conditions, it includes anxiety, phobias, traumatic events, PTSD. They are all part of anxiety disorders. So think about phobia. You probably, when you were young, spiders, for example, something happened to do with spiders and you left it untreated, and you go throughout life and then you come across people screaming when they see spiders, or in my case, birds. I can't stand birds. And I remember it sort of started in secondary school as a joke, and now anything with feathers just completely freaks me out. So if left untreated, it can become entrenched. It can start to impact on your quality of life. It can lead to a depressive episode as well. It can lead to avoidance. For example, if it's agoraphobia, people are afraid to go out, leave the house. They become, housebound. It definitely impacts on their quality of life. They can't go out, they can't see friends, they can't go to work. So, like all conditions left untreated, it causes various issues that just become more reinforced the longer you leave them. So that's why it's good to get the right kind of treatment. And for all conditions, early treatment is always key. So mental well-being is, as I described in the previous question, it's just your quality of life. You stop enjoying the things you used to enjoy. You stop going out. You stop meeting friends. And if it ends up going into a depressive episode, or you have a depressive episode at the same time, then yes, you become withdrawn. You're not socializing. You're sometimes not even taking care of yourself. Some people become so anxious that they just are paralyzed with fear. And in terms of physical symptoms, so again, with anxiety, it triggers your autonomic system. So whenever you have a panic episode or an anxiety episode, you've got palpitations, you're sweating, dizziness, vomiting, fainting sometimes. And sometimes some of these things are misdiagnosed as other things. So a lot of people who have panic episodes or episodes of anxiety that have physical components go to the hospital first saying, I think I'm having a heart attack. I can't breathe. There's something wrong with me. I'm going to die, that sort of thing. And then once the doctor has looked you over and ruled out any physical causes, a lot of times it's down to anxiety, which can present in a physical form. So again, it's just thinking about how, and then another thing in terms of the physical side is stress hormones. So cortisol is a stress hormone. Whenever we're stressed or anxious, we have a lot of cortisol running through our, coursing through our body. Cortisol just causes a whole bunch of other problems. It elevates your heart rate. It causes things to just not to be out of balance. So it's never good to have too much cortisol at any point in time in your system. So to have it on a chronic level, just constantly being high, is not helpful as well. We're constantly looking to bring down cortisol and raise other, neurotransmitters such as serotonin, the happy hormone. So again, that's probably one of the ways in which it can impact on your physical health. So again, people getting worried that they're having a heart attack when they're not, having too much cortisol in your system, which is never a good thing. It affects your sleep. If you're not sleeping very well, then you can't function. So those are some of the ways in which it can affect your physical health. And of course, in terms of mental well-being, it just affects your quality of life. It affects how you react with people, relate with people, how you live your life, and it's, again, these are the kind of things that go on to cause more significant conditions like severe depression and other things that go along with that. So again, like I said in the previous question, a lot of people go to hospital thinking they're having a heart attack. That's usually how anxiety gets. A lot of times it's the physical component of anxiety is what takes people to hospital, because if you think about it mentally, people might not even realize that they're anxious. All they know is that whenever something happens, they have a tightness in their chest. Whenever something happens, they feel like, they can feel palpitations. Whenever something happens, they suddenly start sweating. They have diarrhea. They feel like they're going to faint. So because of those physical symptoms, a lot of people go, there must be something wrong with me. I need to go and see my doctor. And then the doctor goes there and checks everything out, and all your blood tests and everything is normal, and then they start asking questions. Oh, so are you feeling stressed? Are you feeling? And then it all comes out. Oh yes, my son's not something happened with him, or I'm having problems in my marriage, or I'm doing a PhD, my dissertations. There are all sorts of things that cause anxiety. And then when you start digging deeper, it's like, right, so those physical symptoms you're experiencing are not because you have a heart attack or some other physical ailment. It's because you are anxious, or you're having a panic disorder, and that's how a lot of these things get diagnosed. Sorry. Other times you just get people who come in and go, I just don't feel like, especially the ones who have a depressive component. Oh, I don't feel like going out. I don't feel like socializing. My energy levels are low. I'm sleeping a lot. I'm eating too much. I'm eating too little. I've lost weight. And then with further questioning, you find out that they do have a depressive episode, and then you get an anxiety component as well, because then they can tell you things like, oh, I get these episodic feelings where I suddenly get all sweaty and I can't breathe and I'm hyperventilating. And so it's usually quite common that the physical symptoms take the person to the hospital, but a lot of times people come to hospital or to see the psychiatrist because there's something's changed in the way they live or their quality of life, and then on questioning you find out that they could be anxious or depressed or both. So, I mean, there are pharmacological treatments and there are psychological treatments. Depending on, it depends on the situation and what works best. If you take a history from a patient and it's something, there's obviously something going on in their lives, something that's impacting on that, on them, you might want to suggest something psychological to begin with. Talk through it might just be something as simple as counseling, and then you work your way through the more specific forms of talking therapy. But then again, and that might be enough to treat the issue. But then again, depending on how severe it is or how it's impacting on them, that's where pharmacological treatment comes in. If you've tried talking therapy, as Nice Guy's line usually indicates, and that hasn't worked, then you might have to move to pharmacological treatments, SSRIs, minor tranquilizers, which are benzodiazepines. They can help to just kind of bring your anxiety levels down. And a lot of times when you're having talking therapy, if you're too anxious, you can't engage with the talking therapy. So we might want to give you medication to bring your anxiety levels down so that you can engage better. But the best outcome is usually a combination of pharmacological and psychological treatment. Anxiety is one of those things that it can be quite simple to treat if it's a minor thing. It can be quite difficult to treat in things like complex PTSD, if you've been subject to a lot of trauma, if you've gone through some kind of life-threatening event, natural disasters, depending on how severe the trauma is, it makes it more difficult to treat. I mean, people like that, lost their families or friends in Grenfell, for example, that kind of anxiety is going to be difficult to treat. There's a lot of reliving what happened, and if it's PTSD. So again, it's usually a combination of pharmacological and psychological. But then depending on the severity, it can be simple to treat, and some people have to be in therapy for quite a long time trying to work their way through. And even then, it's just them learning to live with it rather than it going away completely. So again, it's just finding out what the best form of treatment is and being patient enough with the patients to, get them through it.